There is a Republican idea that we want to point out to you because this is something the president said yesterday that he's open to. And what that is letting people buy their health insurance across state lines. Currently, what insurers can do is they can only sell policies in the states where they are licensed. The difference in price can be astronomical. Take a look here. Here in New York, where I am, the average, according to a 2009 study, for an individual premium for their health insurance for a year is over $6,600. Go to Iowa, near my home state of Minnesota, the average is $2,600, a $4,000 difference just because you can't cross state lines to buy insurance. Some of that has to do with competition in the state, the cost of living, but another key that we learned is that states have different laws that mandate what insurers can cover. In New York, there are 51 different mandates that your insurance policy has to cover. Take a look at Iowa, about half that, 26 different mandates, that's it. So the more mandates, the more expensive the policy. In New York, they mandate covering drug and alcohol abuse, chemotherapy, and screenings for prostate cancer. Iowa, Kira, doesn't mandate any of that. That's why you're seeing this difference in cost. What Democrats say is, all right, if you want us to get on board with this, you have to have a minimum mandate, a minimum amount of what is covered across state lines for us to get on board. But this is one potential place for agreement that would help a lot of consumers. Kira?
All right, so assuming that this idea of buying insurance across the state lines goes through, how much could it save people?
Yeah. Not that much. Unfortunately, the most recent numbers we have, let's pull it up for you here. This is a CBO study from 2005, and what it found is that an individual can save about 5% on their health insurance if you could buy it across state lines. So if you're in New York, you're paying over $6,000, you're going to save about $3,000. And also, there are some that argue that this could actually raise your premium, and this is why. This is why you heard Republicans yesterday making this argument. Who is going to buy inexpensive policies that don't cover very much? People that are young, people that don't have health problems. So that pulls them out of the health pool, the health insurance pool, that the older folks that have more health problems are going to have to pay more for their coverage. That's a fair argument. That's what you're going to hear time and time again from some Republicans on this issue. So, Kira, even when there's agreement in Washington, there's also some disagreement. But people are writing into us, cnnmoney.com/Twitter, letting us know what they think. What do you think? Did the Healthcare Summit accomplish anything? Let us know. We'll see if they can agree on this one point.